Assalamu alaikum. Today we study prosthetic mitral valve. How we assess the prosthetic mitral valve and what should the Doppler parameters. For prosthetic assessment, uh, and echo there are certain key points. Clinically, history regarding symptoms and anticoagulation status should be available for each patient. It is better to have baseline study for comparison. Knowledge about the type and size of well helps in the assessment. Hemodynamic status at the time of study, especially the level of blood pressure and the pulse rate, is important. Height, weight, and body surface area are the prerequisites for any echocardiography study. Attention should be paid the prostate's opening and closing of the leaflets should be assessed closely. Visualizations of abnormal densities like thrombus, venous vegetation, and the prosthetic well is important. Shadowing may interfere with assessment of location and amount of regurgitations. Okay, this is a Doppler parameter of prosthetic mitral well functions. Peak velocity is less than 1.99 is normal. Above 1.9 to 2.5 is possible stenosis, and above the 2.5 greater than 2.5 is significant stenosis. We should not only measure the peak velocities, but also we should see the mean gradients, the dvi and the effective orifice area and the pressure half time. So the mean gradients is less than 5 is normal, 6 to 10 millimeter of mercury is possible stenosis, and greater than 10 mean pressure gradients are significant stenosis. VTI DVI is formula is VTI prosthetic mitral valve divided by VTI of LVOT. Less than 2.2 is normal, 2.2 to 2.5 is possible stenosis, and greater than 2.5 is significant stenosis. Effective orifice area is greater than 2.0 is normal, 1.2 is possible stenosis, less than 1.0 is significant stenosis, and also pressure half time is less than 130 is normal, 130 to 200 is possible stenosis, and greater than 200 is significant stenosis. This is the DVI of for the prosthetic mitral valve formula. VTI of prosthetic mitral valve divided by VTI of LVOT. Etiologies for elevated peak E velocity and mean gradients for mitral prosthesis. Pathological stenosis or obstruction is thrombus, venous, and degenerations. Function stenosis like high flow, patient prosthesis mismatch, and third one is significant regurgitation, prosthetic or periprosthetic, paravalvular or valvular. Echocardiographic evaluation of elevated prosthetic mitral gradients. Whenever there is a elevated peak velocity and mean gradient across the mitral valve prosthesis, always look for pressure half time. If the pressure half time is greater than or equal to 130 meter per second, uh, millisecond, suspect pathological stenosis like obstruction, and look for thrombus, venous, and degeneration. If pressure half time is less than 130, there may be a normal wear if the gradients are normal. But if the gradients are elevated, then suspect functional stenosis or significant mitral regurgitation. In such cases, the next step we will be calculate VTI ratio or DVI. If the VTI ratio is greater than 2.2 in case of mechanical processes or 2.3 in case of bioprocesses, then suspect and look for significant pathological mitral regurgitation. But if the VTI ratio is less than 2.2, then calculate index effective orifice area. If the index effective orifice area less than 1.2 centimeter square per meter square, then the diagnosis will be the patient process mismatch. Otherwise, it will be high flow state. Pathological stenosis obstruction mitral processes. In case of pathological stenosis obstruction of mitral processes, there will be increased velocity, increased mean gradients, increased pressure half time. Prosthetic valve regurgitation. In case of significant pathological prosthetic valve mitral regurgitation, there will be increased EVO velocity, increased mean gradient, short pressure half time, increased VTI ratio. Patient processes mismatch. In case of patient processes mismatch, there will be increased E velocity, increased mean gradient, short pressure half time, uh, VTI ratio less than 2.2, infective index in effective orifice area less than 1.2 centimeter square per meter square. Effective orifice area should be calculated by continuity equation, not by pressure half time. Consequences of patient prosthesis mismatch and the mitral position, it will result in persistent pulmonary hypertension, poor exercise tolerance, worsening long term survival.